Hello, my name is Peggy Franklin. I'm a member of the California Partnership for Improving Dementia Care. I've worked in senior housing and skilled nursing care for almost 30 years. And I feel that within the last several years, we've really made tremendous strides in providing person-centered care for those with dementia and also the care of their families. And we're doing the same thing now in these really challenging, different times for us, still trying to provide the best type of care and to look at optimizing that person-centered care and taking care of families the best way we know how. We're going to take a few moments today to talk about some of the ideas that might be good for you to use to focus on the resident and their family. And some of these things you might be doing already, so very good, you know you're on the right track. You may have some of your own ideas that you're sharing with colleagues that work with your residents, and that's really, really great. So let's just take a few moments. I know you're all really busy people, and hopefully these will be suggestions that you can put into use. Today we're going to just, again, take a few minutes to talk about the importance of communicating with family and friends, some of the tools that you can use to communicate, and then managing resident and family worries, because you've probably experienced at this point in time, since we've had our COVID situation since the middle of March, that there are a lot of family concerns about not being able to be with their residents, their family members, not being able to physically connect with them, and then how you and we together providing care are taking care of their family members. So it's very understandable. Communication is important because in the middle of these emergency situations, such as COVID pandemic, we're presented with special challenges. I just mentioned families not being able to physically come into the building and see their spouse or their parent is extremely stressful. Residents may differ in their awareness about changes related to COVID-19, and they may become very anxious when they don't understand what's going on. Residents may not understand why their family and friends cannot visit, and you do the best that you can to communicate to them why that is so. Another reason why it's really important to communicate is that care teams may change frequently during the pandemic, and it's important to share all information with all individuals who are caretaking for the residents. Family and friends need to know their loved ones are safe and secure, and staff need to learn about residents from families. So it's a two-way street, so the communication channels should always be open. Keeping family and friends connected, families need help communicating with loved ones during this crisis. Caregivers can help families connect through a variety of methods, including scheduling telephone or video calls to keep connected and encouraging family and friends to send notes and photos. Developing a what you should know fact sheet to explain what families, friends, and staff need to know in the event of an emergency. Providing information about how families can receive updates or talk to a care provider about the person living with dementia. So the facility is providing information to families saying, this is how you can get in touch with us, and this is how we're going to be getting in touch with you to keep you posted about what's going on, what our current situation is as a community, but also individually about your loved one. And then lastly, ensuring that adaptive devices are available to the resident when appropriate, such as hearing aids and eyeglasses. To have those adaptive aids, your eyeglasses and your hearing aids close at hand can be very reassuring. The Alzheimer's Association, their dementia care practice recommendations suggest that one of the most important things that can be done is to provide a information sheet, and especially important during this time of COVID-19. It's recommended that a HIPAA-compliant personal information form is completed for each person and kept in an easily accessible place. Information on the form can include the resident's preferred name, whether it's their first name, their surname, Mr. Jones, Mrs. Smith, their cultural background, religious or spiritual practices, past hobbies and interests. And I would add here that you may become aware of new interests and hobbies that the resident has that would be important to put on the sheet and then to share with family members. The names of family and friends, what upsets the person and what calms him or her down. Some of the particulars about their sleep habits, their eating and drinking habits. They may have stayed the same, they may have changed over this time period because of some additional agitations, because of stress for our residents. So things might change. And again, to be able to communicate those to family members and friends. Their typical behaviors, the normal structure that they prefer, and their routines. The last one is extremely important to really focus on their remaining abilities and motor skills, their verbal processing ability, their ability to communicate, and the methods that they're communicating. We've seen, unfortunately, a decline in some of the ability of people with dementia, both within a skilled nursing facility and then for those people who are still staying at home. That the failure to thrive is indicating some diminishing abilities and motor skills and communication ability. But we have the advantage in a way because our residents are living within our community, then we have the ability to really focus on what their levels of communication are and to strengthen those if possible. Our community care licensing for the state of California has also produced best practices. And those include focusing on person-centered care, ensuring communication with residents, continuing a routine, support connection with family and friends, to observe behaviors, and to note any behaviors that may help prevent additional illnesses. And I'd like to take just a couple of moments to make a few comments on each category. In the person-centered care area, given that we have a care team that frequently interact with residents on a daily basis, we have the ability to share information about individuals with all of the caregivers, including those who are temporary, from other departments, or from other care settings. And then again, to communicate that with family members and friends. To ensure communication with residents, tell those who are aware of what is going on that COVID-19 is a virus that's in our facility, and people who normally visit have to stay at home, and that we have to keep within our community here, within our building, so that we are being responsible and we're not spreading that virus. And then provide truthful, simple answers to concerns that residents may have, that everybody is trying to help each other, and we're providing ongoing comfort and reassurance to those who may not be as cognitively aware as others. I mentioned routine, maintain a consistent environment and routine with minimum disruption if possible, ensure regular exercise and safe spaces to walk about, allow time for outdoor activities if appropriate and possible, and provide activities that can be done in rooms or apartment settings that are appropriate for each resident. When we talk about support connection for family and friends, as mentioned before, schedule telephone or video calls through FaceTime, through Skype, through Zoom, or other programs that are out there. There seem to be more and more cropping up that are available to us, which is a great thing. And they all assist in providing access for families to be connected with residents. Excuse me, to encourage family and friends to send notes and photos or visit through a window. I've heard of different communities allowing family and friends to come to the windows if their family members are actually, let's say, living on the first floor and they can really see into their room. If that's not the case, communities are bringing residents to windows and doors so that there unfortunately is that physical barrier, but certainly the visual is there. So it's extremely helpful for families and for residents. And in many cases, as you know better than I, working in the community, that sometimes residents are not really able to communicate. But when we think about the family's need to communicate, that's where it becomes really important to still do that, even though we may say the resident is not at this point in time able to communicate. But then again, we never know. So let's make sure that we're providing those consistent support connections for family and friends. When we talk about observation, watch more carefully and thoroughly about the rooms that people are in, check on sudden changes in the rooms, the ability for residents to understand what's going on with this current situation, any changes in behavior, and to respond to those behavior patterns that might be changing. And then lastly, to note behaviors that may help prevent any further illnesses. Individuals in care with dementia may have reduced ability to follow or remember directions and need frequent reminders. Place signs with pictures where they will be noticed, such as in the bathrooms, that it's good hygiene to constantly or frequently wash your hands, to supervise that, to suggest to residents, avoid touching your face, avoid physical contact with other residents and staff, constantly talk about social distancing. Extremely difficult in a memory care setting, but it's important that that happens because then it diminishes the spread of the disease. Supporting family and friends. During this time of COVID-19, families and friends need constant reassurance. And the best way to communicate that their loved ones are receiving the best person-centered care is communication. It's not always easy to do because your time is spent with the resident. There's only so many minutes in the day, and we want to make sure that we're giving the best care to each resident, and yet at the same time to communicate with families. And families, I'm sure, have been contacting you saying, how's my mother doing? How's my husband doing? How's my wife? And taking time to do that with patients is a challenge for staff. We realize that, but so important to do. So encouraging frequent inquiries and dialogue, assist with phone calls. Many times it's very helpful if you're sitting on the phone call with the resident, because then you can communicate to the family member the things that have been happening, as an example, maybe with an activity, and the resident is not able to communicate that, but you're able to say, let me tell you what we did today and how your mom was participating in that and how it made her happy, or she sparked up and was smiling. That, of course, makes the daughter, the adult children seem reassured and give them confidence that we're doing everything that we can do. and then provide consistent updates through emails and letters. And that's not just, as I mentioned, through the videos or the phone calls with the immediate caregiver staff, but that also includes providing letters from the administrator saying what's going on in general in our facility, updates on the information you're receiving from California Department of Public Health, from community care licensing, any tips that can be passed along for those being at home, any positive messages that we're looking towards the future about when we might be able to be together again. I mentioned these are some references here. The Alzheimer's Association has some great information for us. That information sheet that we talked about before, the California Department of Social Services, the community care licensing that I referred to, that's in one of the slides. And then lastly, I would mention, again, the California Department of Public Health. They have produced some guidelines that might be very helpful at this point in time as we look forward to resuming visitation. And that doesn't mean that we're just going to throw open the doors and everybody will come in. There'll be certain guidelines, but it's positive to be able to think about that among ourselves and then to also pass that along to family and friends, that hopefully there's light at the end of the tunnel. I want to thank you for everything that you do, even before the virus. It's not an easy environment to work in. It takes special people to really provide person-centered care for those of our residents with dementia and memory issues. And I want to thank you particularly during these times, because we know that you've really stepped up to the plate and done all these creative activities that are more time consuming and really stretch you more. So thank you so much for that. And we keep you in our thoughts, and anything that we can do to provide support, that's what we're here for. So don't hesitate to contact us. So thank you for all your good work, and know that you're on the right track, and remain safe.